All right, looks like we've got a great group here. So thank you again for joining us for how to safely exercise during pregnancy. I'm joined here with Dr. Katie Ouillette-Harrington, who is a doctor of physical therapy, a pelvic health specialist, a sexuality counselor, and educator. And she shares tons of great information with us regarding pelvic health and pregnancy health. So I'm excited to turn it over to Dr. Katie.
Hi, everyone. Thanks for coming. As Kate said, I am a pelvic health specialist. I also am a personal trainer, and I am trained as a pregnancy and postpartum corrective exercise specialist. So I love working with pregnant and postpartum patients and really love the exercise aspect of everything. So our objectives for today are understanding the location and function of your pelvic floor and core, learning what happens to your body during pregnancy, and how to safely exercise throughout all trimesters of pregnancy. I talked a little bit about my professional background. So I was a certified personal trainer through the NSCA, went to Delta, got my health fitness specialist, group fitness, a Bachelor's of Science in Kinesiology from CMU, and I stayed there for my doctorate in physical therapy. And then since then, I have done numerous hours of training to become a pelvic floor specialist. Personal background, I live in Midland with my family. I have 2 stepkids, a baby, a dog, and a husband. We are avid hikers, campers, all the outdoor summer Michigan things, and I am a runner. So just a disclaimer about this presentation. It is not a substitute of instruction from your OB gynecologist, provider, or midwife, PA, NP, whatever you see that is specializing in pregnancy and postpartum. This is not a substitute of advice from them. In the end, they are giving you the kind of finalized information. So female-bodied anatomy, if we're looking at this picture on the left, it is as if you cut your body in half hot dog bun style, and you're looking in from the side. So we see your core muscles are right here. The back of your body is here. So this is your sacrum and then your tailbone. Then we have your core muscles, your pubic bone in the front. All of this pink that you see here, those are your pelvic floor muscles. They kind of form a sling at the bottom of your pelvis. So then from there, we can see your bladder, uterus, vaginal canal, and your rectum. So this one on the right is looking from the downwards up towards your head. So we have, which would be your legs here. Pubic bone is on the front, tailbone's on the back. You have your bigger gluteal muscles that are coming in from here, attaching. And then we have all of your pelvic floor muscles form this circle. So we have your urethral opening, vaginal opening, rectal opening, and then those are all of your pelvic floor muscles. Looking at the functions of your pelvic floor, think about the 5 S's. So we have support of those pelvic organs that we just looked at, has sphincter control, meaning it closes off the urethral and rectal opening so we don't pee and poop when we don't want to pee and poop. Those muscles also have to be able to relax to let everything out. These muscles also help with stabilization of our pelvis. They work directly and collectively with our core, low back, and hip muscles to make sure that it's happening properly. We have sexual function, so ability to have an orgasm and pleasure with sex. On the opposite end, those muscles can cause pain with intercourse at times. And then a sump pump or a pistoning mechanism. So if we have your diaphragm here and your pelvic floor is here, when you breathe in, your diaphragm will lower and flatten, and then so should your pelvic floor. When you exhale, it should come back up. So if we're using that diaphragm correctly, using it all the way around, we have natural lengthening and strengthening of the pelvic floor, which is kind of like a pistoning mechanism. And we'll see a good visual of that in a few slides. So what makes up your core? If we think about our whole abdomen here on the front, to the sides, down here, and then to the back, think of it as a pop can. The front of the pop can is this muscle right here called your transversus abdominis. The bottom of the pop can is your pelvic floor, which we just saw images of that a few slides back. we have your diaphragm on top and then muscles that line the back, which we'll see on the next slide. So as we talked about, your pelvic floor is the support system that connects from your pubic bone to your tailbone, supports those organs, and then the 5 S's, functions of the pelvic floor. So support, sphincter, sump pump, stability, sexual function. Transversus abdominis is this nice, beautiful muscle right here that lines the bottom of your rib cage off to the sides, inserting into your back. It goes to the front of the pelvic girdle all the way down to your pubic bone. This is the deepest muscle of your abdominal core. It works directly to support your pelvic floor. It's supposed to co-contract with it. So let's say you do a Kegel, you should feel this muscle contract as well. It's very subtle. It is a stabilizer, not a mover. So if you think about doing like crunches or sit-ups or like bicycles, anything like that, you feel those core muscles really contract and you get a nice big movement with that. Whereas the transversus abdominis, it's not moving a lot. So it's going to be very subtle. These muscles work collectively to lengthen and stabilize the spine, pelvis, and pelvic organs. So that transversus abdominis is the front of the pop can. The diaphragm, which we see here, is the top of the pop can. So it sits way up high in your ribs. As we talked about, it lowers and flattens when you inhale, and then when you exhale, it elevates. And then this multifidus that we see, this muscle lining the back of the spine, those are short, deep muscles that lay along the whole spine. So from the bottom of your neck down all the way to your sacrum, into your sacrum. Again, these muscles also have to contract synergistically before movement to lengthen and stabilize the spine, pelvis, and pelvic organs. So all of these are important for proper pelvic floor core functioning. And if we come back to that pop can analogy, looking at all 4 sides of the pop can, if all of those muscles are working correctly, the integrity of them is great, think of that as the pop can being closed. So when a pop can is closed, you don't really it doesn't move very well. You push on it and it's pretty stable. Now, if you were to open the pop can, the integrity of that would be lost. So you could like crunch it and move it around a lot more. If we come back to thinking of that pop can as our body, the muscles that would be affected, let's say your diaphragm. So during pregnancy, that diaphragm gets pushed up, it can't move as much. With your core muscles, they get stretched out because baby is growing and your belly is growing. You don't really have a choice with that. With pelvic floor, you are getting like a stretch induced weakness because of all the pressure coming down to the pelvic floor. So low back muscles, any low back pain, injuries that you've had, that will change how the muscle functions. Sometimes we'll get the forward curvature of our low back as baby grows. That will change how the muscle is able to stabilize and do its job. So any of those will change the integrity of the pop can and make it so it is not as strong. So all of these are important when it comes to maintaining function throughout pregnancy and being able to exercise safely and properly. So our core at work, I promised a good image with the pistoning mechanism. So the top here is your diaphragm, the bottom is your pelvic floor. You can see our nice pelvic organs laying in this pelvic floor hammock. So we have our breath in and then our breath out. So when you breathe in, it comes down. When you breathe out, it comes back up. So you can see you get natural lengthening and strengthening of the pelvic floor, but also the core muscles here. So this canister balance is important for controlling increase in intra-abdominal pressure and decreasing pressure onto the pelvic floor. Intra-abdominal pressure increases with coughing, sneezing, laughing, lifting, anytime you're holding your breath. So all good things to note. Physical changes during pregnancy. So we have increased blood volume and heart rate changes. That will make cardiovascular, endurance limited. So if you notice, even very early on in your pregnancy, in the first trimester, if you were trying to do things that you were doing prior to pregnancy and you're like, I can't breathe, that was why. As you progress, as baby gets bigger, so into second and third trimester, your rib cage will expand, that diaphragm will lift up, your lung volume decreases. So that will, again, make it harder to breathe, will limit exercise tolerance. We also have biomechanical changes. meaning that our center of gravity will change, center of mass will change. So we can't really escape from the postural changes that come because, again, baby has to go somewhere. So all of these will limit your exercise tolerance. And then the uterus compressing on the pelvic veins, that's something that can cause varicose veins, edema, and hemorrhoids. Pain like that can limit exercise tolerance. Varicose veins and edema actually can get helped with exercise. Some more physical changes that happen. I love this picture because it shows you how much your organs get shifted when baby grows. So you can see how much pressure is coming down into your bladder. That's why you have, and one reason why you have to pee so much and why you feel like your baby's kicking your bladder. It's very possible that they are. You can see these over here are your intestines. So again, things are just getting squished, and it explains why we feel the way that we do when there's a baby in there. So with all of that pressure that's coming down to the pelvic floor, you can see why we would get that stretch-induced weakness of the abdomen as well. Increased pressure onto those pelvic organs. Forward head and shoulders will kind of round like this to counter the center of mass that's growing out of your belly. And then your low back will arch, making those low back muscles tight. So some changes here can lead to low back pain, sacral pain, sciatic type symptoms, neck pain, headaches, all the fun stuff. Changes in metabolism. This is very important when it comes to exercise. So your metabolism increases 40 to 50% at rest. So this is not time to count calories, for a calorie deficit rather, like make sure you're getting enough food. Carbohydrates are needed for brain and baby. So carbohydrates and protein are great. Fats are great. All of them are, but make sure you're not cutting anything out unless your doctor says so. Fluid requirements increase during pregnancy, so make sure you're drinking enough water, especially on days you'll be exercising. Drink throughout your workout, especially afterwards, especially if you're sweating more. So in the summer, if you're a little bit hotter, make sure you are replenishing those fluids. Eat prior to exercise so you don't have a hypoglycemic episode. And then if you are losing weight with regular exercise, you really need to focus on increasing those calories because pregnancy is not the time to lose weight. Another change that can happen with pregnancy is called the diastasis recti abdominis, or DRA. It's a separation of your rectus abdominis muscles and overstretching of that linea alba. So here we have the muscles are together, here they separate. This is normal for most pregnant women. It does continue postpartum on occasion. Physical therapy can help with that. Avoid exercises or motions that increase doming along that separation. So if you are, let's say, going to lie on your back and you're going to sit up and you see like almost like a bread loaf or a doming or a peaking, anything along that midline muscle, you know that that is something we need to modify. So log rolling to get up or laying down. So if you're getting up off the surface, turn onto your side and then press yourself up so you're not adding so much pressure onto the pelvic floor and that center abdominals. So watch that during exercise. I don't love sit-ups and crunches in general, but definitely not for pregnant people because of that diastasis that occurs, especially during the later third trimester and the pressure that can be added onto the pelvic floor. So myths of exercise during pregnancy. If exercise is done properly and for if you have any health issues, like maintaining the proper precautions within that, it does not increase incidences of miscarriage or birth defects. It does not increase incidence of membrane rupture or premature labor, and it does not alter the quantity or quality of breast milk. So again, that is if it is done properly. However, with that being said, there is a limit of research that is done with pregnant people because it is not ethical or legal. You can't put pregnant people in a study and be like, let's do all these things and see what happens, because potentially bad things can happen. So there is a limit in the scope of human studies. So just keep that in mind. So benefits of exercise during pregnancy. Aerobic exercise in general will improve your quality of life. It helps with anxiety, depression, mood, and there are studies that note a reduction in postpartum depression if you're exercising throughout and after pregnancy. If you are exercising during pregnancy, it helps with the decreased risk for gestational diabetes and hypertension or preeclampsia, which is that during pregnancy. Labor can be shorter, easier, less complicated. You have a better recovery and return to previous level of function in the postpartum period, and it reduces excessive weight gain. Absolute contraindications for exercise during pregnancy, meaning if you have these, probably exercise is not in the cards for you. If you have pregnancy-induced hypertension or that preeclampsia, sometimes exercise can increase your blood pressure while you're doing it, so that would be why for that. Ruptured membranes, premature labor, persistent bleeding, incompetent cervix, or if you got a cerclage, poor fetal growth or multiple fetuses, placental disease, history of miscarriages or premature labor, restrictive lung disease, or heart disease. So this would be a question, if you have any of these things, to absolutely talk to your OB. Because depending on your health and your activity prior to pregnancy and during pregnancy, you could be walking for exercise. So maybe you're not going to go for a run. Maybe you can't go for a bike ride or lift heavy weights, but you can possibly still walk unless you're on bed rest. So questions to always ask your OB. Relative contraindications, meaning there's not an absolute no-no to exercise. You can probably do the running, lifting, higher level, depending on your activity prior to pregnancy. Again, something to ask for through your OB. Extreme over or underweight, sedentary lifestyle, history of poor fetal growth or rapid labors, bleeding in early pregnancy, breech baby, cardiac palpitations or arrhythmias, anemia, chronic bronchitis, heavy smoker, poorly controlled hypertension or type 1 diabetes, or intrauterine growth restriction. And again, if you have any of these things, if you have a history of them, ask for clarification from your doctor. Contraindicated activities, meaning these are a no-no for any pregnant person. Scuba diving, water skiing, downhill skiing, ice skating, rollerblading or roller skating, anything that can increase your risk of falling. So high impact sports as well. Gymnastics, horseback riding, hot tubs, or saunas, which increases your body temperature too much. General exercise guidelines. So in general, it's safe to continue with pre-pregnancy level of exercise unless told otherwise by your OB or midwife. No high impact sports. Avoid laying on your stomach for extended periods of time in second and third trimesters. That is supposed to say your back, not your stomach. That is my fault. And you do want to avoid laying on your stomach, however, in your second and third trimester, but for extended periods of time on your back. Because you can get what's called hypotension, because there are veins and arteries that exit the bottom of your heart that the baby can compress on, and that can cause a decrease in blood pressure. So if you are laying on your back beyond your second trimester, monitor for symptoms of faintness, dizziness, lightheadedness, nausea, agitation, or profuse sweating. Avoid any breath holding with exercise, and take caution with overheating. So we don't want to increase that body temperature too much. And breath holding will increase your blood pressure, so we don't want to do that. Warning signs of stopping exercise. So any vaginal bleeding, shortness of breath prior to exercise, or when you're at rest. So let's say you're lifting weights, you did a set of 10, you stop, you're resting, 1 to 2 minutes later, you still can't breathe well, I would not continue. If you have any dizziness or a headache, a severe headache, chest pain, any muscle weakness outside of exercise. So if you're feeling like muscle fatigue, muscle weakness during exercise, understandable. If you're not doing anything and you feel that way, I would call your OB. Calf pain or swelling, that could be a sign of a deep vein thrombosis, preterm labor or contractions. Stop exercise for that, obviously. Decreased fetal movement, amniotic fluid leakage. And then if you have any signs of dehydration, absolutely stop exercise and drink some water. So symptoms of dehydration are dizziness, racing or pounding heart, urinating only small amounts or dark yellow urine. Also, if you are dehydrated, it's good to add in some electrolytes in there. So like body armors, coconut water, sometimes liquid IVs. As long as you don't have gestational diabetes, then you're gonna have to watch your sugar intake. All right, so for resistance training, what can we do here? So 3 times a week with a rest day in between to give your muscles time to recover. You can do either a split body routine or a full body routine, which I'll have example programs in a couple of slides. So what that means is a split body routine is one time you do upper body, one time you do lower body. Full body routine is you're doing full body in that one session. So beginners, I would say, let's just do one set of 10 to 15 reps of lower weight. Experience, you can work on that 2 to 3 sets of 10 to 15 reps of lower weight. Make sure you have a 2-minute rest in between your sets if you're doing more than one. Try to stay active during. You can do some stretches, do some walking, keep your heart rate at a moderate level. And then if you are experienced with weightlifting and you know you're like 1 rep max for certain things, keep that below 70%. And again, the 10 to 15 reps with the lower weight, we're working on more endurance here. Slow and controlled movements. Make sure you're not holding your breath. You want to do a 5 to 10 minute warm up and cool down prior. Aerobic training. So pregnant people can still follow the American Heart Association recommendations on exercise of 150 minutes of moderate intensity a week or 75 minutes of high intensity a week. And I would say that the high intensity is okay if you were doing this prior to pregnancy. So just for example, if we're looking at that 150 minutes, we can do 30 minutes 5 times a week, or it can be broken up into 10-minute increments if you don't want to do the 30 minutes at a time. Moderate intensity is your heart rate is raised, you are sweating, you can talk normally, but you can't sing. So if you were doing some cardio and your heart rate is getting so high that you can't even hold on a conversation, so if you're like running with someone, for example, and you can't talk to them, that's probably a little too high. So examples of this would be brisk walking, gardening, housework, light running, or a cardio machine. Also, make sure you have a 10-minute warm up and cool down. And a sample program for this could be walking for 10 minutes, 30 minutes of aerobic exercise, 10 minutes of stretching, and 10 minutes of relaxation. The stretching and the relaxation can be put together if stretching is relaxing for you. The relaxation part is definitely important. All right, example programs for combining cardio and strength training. So example 1, this is a full body routine. So Sunday you can do cardio, Monday do a full body routine or a circuit training that can get your heart rate up and can count as some cardio as well. We'll rest on Tuesday. Wednesday you can do cardio, Thursday another full body routine or circuit, Friday yoga, so stretching, relaxation, and we're going to rest on Saturday. Another example here, this will be for a split body routine. So Sunday we can do upper body and cardio. Monday we'll do yoga. We'll rest on Tuesday. Wednesday lower body and cardio. Thursday yoga. Friday a full body circuit, and then Saturday we're resting. And this doesn't have to be the exact days. Just make sure that if you are weightlifting and you're doing a full body, you're taking a rest day in between. And I wouldn't go more than 2 or 3 days without taking a rest day if you are combining cardio in there. Depending on what type of yoga you're doing, I wouldn't really consider that a high of enough level of exercise that you need to rest, but that will also be dependent from it'll be different person to person depending on your level of activity prior to pregnancy, and again, what type of yoga we're doing. Generally with prenatal yoga, it's pretty gentle and relaxed. Common impairments seen postpartum. This is important to note, as some of these can actually happen during pregnancy too. So urinary or bowel incontinence, urinary frequency, that mommy belly, which I don't love that term, but people know that, what it means. So, or that diastasis recti, abdominal separation, pelvic pressure or discomfort, pain with intercourse, low back, hip, or pubic bone pain, C-section scar discomfort. We do have a risk of pelvic floor dysfunction with prolonged pushing. I believe it's like 120 minutes. about 120 minutes, so about 2 hours. Labor less than 20 minutes, so if it happens very quickly, use of forceps or vacuums, because that will increase your risk of tearing. And then prolonged stretch in the pelvic floor can cause weakness with or without vaginal delivery. So just because you have had a C-section doesn't necessarily mean you don't have a pelvic floor issue. And how pelvic floor physical therapy can help. We assess the entire system and evaluate strength, function, coordination of the abdominal and pelvic floor muscles. We look at the hip muscles, we look at posture. We can help with maintaining your exercise throughout pregnancy. We can help with maintaining your strength throughout pregnancy. We can help with labor and birth prep. We can help with pain. We can teach you perineal massage, so that helps with decreasing tearing, which we know causes more issues. We can check your pelvic floor strength and coordination for proper functioning, postpartum recovery, postpartum return to exercise. We can help you teach you things that will help lessen the risk of tearing, and exercise program planning for during pregnancy and early postpartum. And we do have a few different locations for pelvic floor therapy. We have Caro, Frankenmuth, Midland, which is where I am, and then Saginaw and State Street. So our upcoming webinars, which is a great subsequent for our next one, is that September 10th postpartum return to exercise. So we went over today how to exercise safely during pregnancy, and we can talk about returning to exercise safely following. And then in October, we're looking at the 4th trimester, so caring for your body post-delivery, and that's with things even besides exercise. So that's looking at more of a holistic approach. November 12th, we're talking more specifically about the diastasis, and then December 10th, we'll talk about prolapse. And let's, do you have any questions, Kate?
I haven't had any come in yet. We've got a few people who might be thinking on a question. If you do have a question, just click the Q&A button on your screen, and that will come to us anonymously. I did just want to mention a couple things. Everybody who registered today is going to get a link to the recording of this. So I know we're trying to keep these webinars on a more concise side, but it's a lot of information to go through in a half an hour, so you can rewatch that at your leisure. I'd also encourage you, just anybody who is going through pregnancy or has had a pregnancy in the past, if you are having any dysfunction, to schedule a free 15-minute screening with our specialists. Chances are they will be able to help you and provide some relief from your symptoms. And if they can't, they can make a recommendation on what your next steps should be. So I don't see any questions come in, so I guess you answered them all, Dr. Katie. So thank you for sharing with us, and for also getting those other webinar topics on the agenda for the future. So we're looking forward to that.
All right.
So thanks again, everybody. Thank you, Dr. Katie, and
You're
have a great
welcome.
day.